Welcome to VPNG NCLEX Academy. We teach NCLEX to local and foreign educated nurses, and our goal is that with our 3 months lecture plan and schedule, any nurse who passes through us and is attentive can pass the NCLEX the first time. Based on some patterns that throw nurses off balance in answering NCLEX questions, we decided to do this series where we expose NCLEX traps, areas in which NCLEX likes to trap candidates, so that you know what to look out for and prevent losing your marks. Today we'll talk about the new medication plus rash trap. Say you are reading a scenario and then the client has a rash, and then you pay attention to see that they just started on a new medication. Because NCLEX will not simply ask you whether or not the patient has a rash. Instead, the exam is testing your ability to recognize early warning signs of life-threatening drug reactions. And one of the most recently tested patterns is the new medication plus rash combination. Right? On the surface, it seems benign. A patient develops a rash, full stop. But NCLEX hides a critical safety cue in the timeline or in associated systemic symptoms or in the medication type. So the exam is now looking for your clinical judgment. You'll likely see a scenario like patient recently started a new medication, often anticonvulsants like lamotrigine or antibiotics. And the scenario will tell you 1 to 3 weeks later, they develop rash, fever, oral or ocular lesions, fatigue, joint aches. NCLEX might even add some distractors to test your priority thinking. What do you do? To give antibiotics, to apply a topical cream, to monitor vitals, or to notify provider. The trap is in assuming that a mild rash is a routine or something that is manageable at home. If you want to succeed, you need to be able to recognize life-threatening drug reactions. For instance, Stevens-Johnson syndrome, toxic epidermal necrolysis, or drug hypersensitivity reactions. The exam expects you to, 1, identify the timeline. It will usually say that the drug was started recently. 2, recognize the pattern of systemic symptoms. And then the third one, you should try to escalate safely and urgently. You need to be able to prevent irreversible skin and mucosal damage. And why do people fall for this trap? Because surface level thinking. Many students might see rash and think minor allergic reaction, or they may underestimate the systemic cues, or they could even misinterpret timing. Immediate reactions are obvious. NCLEX might often test delayed reaction, say 1 to 2 weeks after the client started the drugs. And NCLEX might even distract you. For instance, you could see in the options to use topical treatment or analgesics. They seem safe, Monitoring vital signs may seem reasonable. While they are reasonable, they are not the most urgent NCLEX answer. How? We've said so many times, you need to look out for what is most threatening, what is most urgent. So how do you manage scenarios like this? You need to check the timeline. Did the rash appear after a new medication, or how many days or weeks since initiation, right? Then you look for systemic cues, fever, fatigue, joint pain, oral or eye lesions, and then you recognize priority. You need to stop the offending medication immediately. Then notify the provider, prepare for hospital admission if indicated, and then you can give supportive care like fluids and pain control. The final step is to ignore comfortable distractors. If you see scenarios like this, topical creams are a distractor, observation only distractor. The key question is, what action will prevent irreversible harm first? And if you're unsure, you can make an educated guess. So when multiple reasonable interventions appear, you need to ask yourself, which action addresses the life-threatening mechanism first? If you see topical creams in the option, does it affect life? Does it address life threat? No, so not. If you see pain medication, no. But if you see call provider or stop the drug, that's where your answer is supposed to be. So you need to select the option that stops the progression of systemic reaction. To summarize this trap or this point, if you ever see new medication, a rash, and systemic symptoms, you need to stop the drug. This is a life-threatening scenario. Do not be fooled by distractors that may seem benign. And then remember, prevention of progression is your first priority. If you